let's talk about how I do this. I'm going to walk you through from hairline design. There's going to be a lot of videos here. They're from my book. And walk you through how to just do it from scratch. Now, obviously, you can't learn hair restoration in 1 hour, but at least you're going to see a really very in-depth overview. We're going to talk about hairline first, because the artistry, we talked about artistry when we talked about fat grafting. Artistry begins on a good hairline design. And it means, you know, if you understand this, everyone that draws a hairline is going to draw a slightly different hairline. But you have to follow certain principles of safety, because you can draw the ridiculous hairline and then you're in trouble. We're talking about now basic parameters so that you can get artistic, not autistic, but you have to start with safety. So where does the lowest acceptable point in the midline start? It's a point where the horizontal head matches the vertical head, an intersection of 45 degrees right there, okay? That's the lowest acceptable point. You go below that, it looks unnatural. Do people have hairs that sometimes sit on the forehead? Yeah, rarely. You could see some variations in nature. But please don't create that, because it won't look natural. And you can go higher than that. But if you go way too high in that central point, you can also create a useless result, because you don't get a frame to the face. The goal of a good hairline is an aesthetic frame to the face. So these are the things that you're going to really think about when you're designing it. The next step is to think about, well, let's take a step back, sorry. Next thing is to look at roughly where this position is. And the Da Vinci division is the third divided. But this is the lowest acceptable point. And you can go higher than this, just don't go lower. So the next thing after that is you want to mark out your other points. So I look at the lateral limit. What's the lateral limit of your hairline? It's basically at your lateral canthus. That's why a comb over looks like a comb over, because you're taking hair from the temporal hair and moving it medially. You want to keep it medial, or at the point of the lateral canthus. Anything lateral is temporal hair, anything medial is hairline. So I draw those 3 points, and then I join them. How do you join them? Well, there's 2 ways, 2 simple ways. Again, this is a lot of just making it easy. You can do a rounder shape one, or more of a suppressed design. And these are the advantages of either one, depending on the patient's head shape, how much hair loss there is, what age they are, all these factors. I don't need to get into too much detail. But that's basically how you start making a basic design on those 3 points. I'll show you in a video exactly how to do it. And then remember, always check lateral, because a hairline should not slope down on the side view. Sometimes you get so fancy in your frontal hairline, and you walk to the side and it doesn't look natural, because the slope has got to go up. It cannot slope down when you're doing this. So the other thing is important is that you can't forget the temples. Now, please, if you're not doing a lot of hair transplants in your first, I would say 3 years of practice, unless you're just doing one case like every few months, and I would say 5 years or 10 years of practice, don't start doing temple designs. Very, very difficult to get natural results. They can look really weird if you don't do them well. But remember, your hairline has got to match your temple. So the more projection of your frontal hairline, the more temples you have to push forward. Today, hair pieces or hair systems look natural. But the reason they can look fake is because the temples are too far back vis-a-vis where the hairline is. So you've got to match the 2 of them. So if you're starting out, please don't design aggressive hairlines, and try not to do any temples for several years, because that's when you get problems. So here's 2 examples. On the left is a more aggressive, slightly aggressive, and the right is someone that just has almost no hair left, and you want to create what's called a central forelock, just a little bit of a circle in the front without a full hairline. So you see how the temples match? You see how the one on the left, there's more of an aggressive temple, and the one on the right is more conservative? All these illustrations are from my book, by the way, just to let you know where I'm getting these. Oh, here's it. Okay. Here's a hairline video. So we talked about hairlines being artistic. Oh, sorry. We talked about hairlines being artistic. The second part of our artistry is the recipient site creation. That is, creating the actual sites where the girls are going to put the grafts into. So we have to understand landmarks, how the flow of the hairline is. If you take, how the parts are here. If you take a look, hairline zone is the first few centimeters across here. The central forelock is a region right behind it. It's the most critical area for central density. The mid-scalp is basically anything behind that here. The bridge or vertex transition zone is the area from horizontal scalp to vertical scalp. That's where the crown starts. And then for people that have enough hair loss, anything lateral to the lateral canthus, they start to lose hair here, both temple, and then we call this area behind the temple the lateral hump, because it looks like a hump. I did this for my book, and I thought, hey, no one's ever really explained this well enough, and I drew this, and I really am pretty proud of it, because I think it's easier to understand what I just told you in a schematic. Because going from, let's do anterior to posterior, the hairline is basically horizontal scalp to vertical scalp. The side, the lateral crease, separates mid-scalp to lateral hump. And same for this side. Then you look at the back side, the vertex transition point or vertex transition zone is from mid-scalp to crown, because crown's on vertical. So if you think of the head like a box, you can start to understand the landmarks. And as remember I said that this is your lateral canthus defining temporal hair. So I think that's an easier way to understand some of these landmarks. Why is it so important? Because each area you design hair differently, which we'll explain in a moment. So central forelock, don't worry too much about the concept of the extended forelock, although I may have covered a little bit here. And then understanding that lateral hump hair is here, which is in the temple, the frontal area, and the mid-scalp. This is very important. When you make recipient sites, where the hairs will go into, they have to mimic how hair naturally flows in real life. So the angle, which is how the hair is tilting vis-a-vis the anterior position, is very, very important. The direction, we talk about this, and the tilt is not so important. Don't worry too much. Just remember angle and direction, okay? Very, very important. So these are the angle and directions for the entire head. The real key for the front of the hairline is that these angles are super low. The biggest mistake is to make these high. We'll tell you how to do that in a second here, but these got to be super low. The only thing lower than this is your temple, and again, this is an advanced consideration, but the temples have to be almost flat. And they sweep down, forward, and back like this. The crown, as you probably know, is a whorl. I'll show you some examples of that. So these are just showing you, and then the lateral hump transitions down like a cascade like this, okay? So why is the central forelock so important? This is the area that I put in 50 grafts per square centimeter or so versus a low density, which would be like 20 to 25, because that's where people, when they look at you, if that's bald, it makes you look bald. So that's my focus of high density, strong grafts, central forelock. The extended forelock principle is a little bit more complex. It just means that when people see you from the front view, they see all the way behind the forelock, and if you can create a barrier here, you can't see through the scalp. So that's just the concept, is the central forelock is powerful, but you still can see around it. Extending it creates visual density where it's hard to see around and see bald scalp. Same thing that I talked about donor tumescence, the recipient tumescence is so important. If you're not using recipient tumescence, as you're making sites, you can bang up against the bone and then damage vascularity and therefore have limited growth afterwards. Okay, how do you create these really super low angles? Keep the patient supine flat. If they're flat, then you can make your angles super low without having to torque your hand. So these are very important low. I'll show you some of these bad corrective work I've done on patients that have had really high angles. And you want to think of this in an interlocking shingling effect like a roof. What does that mean? Like this. If you make your hairs all lined up in a row, this is a frontal view looking backwards, you can see through it. But if you interlock every row like this, there's no see-through effect. So every row is staggered behind it. You can also make them more closely spaced together. So you want to create an interlocking pattern. I typically use needles, although I use punches too, and I don't want to get too complicated. But you want to make sure, like this will accommodate 3 hairs, this typically 2 hairs, this 1 hair follicular units. And making these little bent needles is a great way to make small sites where the grafts fit into. This is an example of a different type of instrument. It's called a solid wire needle. I don't use this very often anymore, but what this photo is illustrating is that your graft has to fit the depth. If you make your sites too deep or too shallow and they don't fit your grafts, you have a problem. So I always start with 2-4 sites, make sure they match, and then when they match, then I know that all those other grafts will be cut to fit. They have to fit like a hand in a glove. So I'm going to walk you through step by step how I build sites. These are stronger graft sites, either diphilic unit grafts or larger follicular grafts. And I build sort of right close to the hairline, but not exactly, because you want to prioritize. You don't want to run out of hair and make all this dense back here and you got nothing up here. I always hit this hard first, and then I feather back here and less and less and less density. Because if you do the opposite, you start back here, go there, you're screwed if you run out of hair. And then I just go back, interlocking them all the way back. And then I start to interlock the smaller grafts going forward, and I build the hairline forward. If you build the hairline forward, then you can build a hairline that resembles a coast of a shoreline like this. If you build it front to back, the tendency is to make the line too straight. So you don't want the line straight. And I'm going to show you physical examples of my work so you understand what that means. This is just a schematic so you understand what I'm talking about. And then you want to finesse it further by you sit there and you really scrutinize it. You look at it, you go, that's still too straight, that needs a little here. And then you start making these little sentinel hairs that are one-hair grafts in front of your one-hair row of one-hairs to just blend and further. If you look at any natural scalp that's beyond maybe an 18-year-old, you'll see little one-hairs sitting in the front. And so you really want to blur this. This should not be a line. And the back side you want to blur as well. Maybe not as aggressively, but you want to blur the back side. So if they have no hair here, you want this to look natural when someone looks from behind at them. This is to show you sites I created for the crown. You can see the whorl pattern. And the key with good hair, this is a really good example, is to show you how everything transitions slowly. You see this? There are no abrupt angle changes. Everything sort of swirls gently. There's no abrupt, sharp changes. Everything flows on a head naturally. If you look at someone that has a full head of hair, you'll see small transitions. This is the hairline here in close magnification. You can see the staggered, and you can see these sentinel hairs, and you can just sort of see, think of a coastline. When you go to a coastline close up, it looks really jaggedy. When you're far away from the coastline, it looks relatively straight. That's the same way that you want to create a hairline. It's like little archipelagos, little pieces of islands floating outward. This is to show you again subtle transitions going into the temporal hair. It just slowly arcs this way. But everything here is straightforward. Another big mistake for junior surgeons is making the hairlines radial. They should be straight, except at the lateral centimeter, where it just starts to arc down into the temple. Big mistake. Make them straight. In fact, what I've been doing, not to make it too complicated, is actually converge them in a little bit. Because if you think about how the head is shaped like this, if you put them straight like this, the hairs will fall out. You want to protect the forelock and bring them in, bring them inward. Focus on that central forelock. So this is just showing the left temple. That's orientation. I know that's confusing. The ear sits over here, the left ear. The nose is over here. This is the left temple transition. Again, too complicated to explain to you, but I just want you to see how different this female hairline is. It is a central whorl. You think of the cowlick with a woman. The angles almost go backwards, exactly the opposite of what a male hairline is, with a closed area. Very complicated. You should not be doing female hairlines if you're just starting out, because you're going to make them look like a man. You want to create really pretty results for women. I'll show you some of my results in a second. Okay, here's a video of recipient site creation. Okay, what we've done is we've marked out the regions. You see the hairline here. What you're seeing in the first line, this is a hairline zone that I'm going to be building principally with 2 hair grafts all the way across here. And as you see the second the front row of 19 gauge sites, so that the one hairs are interlocked and tightly form a barrier to protect against visual show of 2 hair grafts. But they're also dancing out like sentinel hairs. And you can see the design of the front hairline is very, very natural. It's not
too zigzaggy and it's not too straight, which is it's a difficult balance to strike when you're creating a hairline. This is the art of making a good hairline. You remember that we've got probably about 70 rows of 2 hair grafts that are going across here. Those are framed with a deeper gutter of 18 gauge that are covering 3 hair grafts that are just slightly splaying as we go over toward the frontotemporal recession into the temple region. Otherwise, almost all straight going across here. And then a lot of dichromatic unit grafts, 16s that go across this entire area with a little bit of tighter distribution here in what's known as the central forelock, as well as the areas here, the frontotemporal recessions. They open just a little bit as we go down toward the area of his natural existing hairline back here. So this is a good overview of all the site designs, and I think it's important that you see this so that you visually can sort of match up your design work to what you're seeing in this video as sort of a template for where you can strive to achieve an excellent natural result for a gentleman.
Hopefully that was clear for you. What you saw before initially was the macro hairline, how to draw a line. What you saw here was the micro hairline, how to take that line and make it into not a line, how to make the line disappear. So just some results. I've got a lot of results on my website. But you see, you can take a gentleman who's a Norwood 5'6" and make him into a 2'3", you know, and I think that's exciting. With one session, they've done well. You can take a woman in 2 sessions and convert her from a more masculine-looking shape with a little hair coloring and make it look much more feminine. In very coarse, straight Asian, some Hispanic hairs, you've got to make sure those angles are low, and the hairline is, you pick the finest grafts for the front hairline so that it looks natural. I want to talk to you about corrective work. I didn't go through a lot of the technical assistant work. That's what the course I have in St. Louis and the second volume goes through. But if you look, what you're seeing here is poor growth, a badly designed hairline. And do you see how these are all kinky? Looks like pubic hair. It's due to the fact that the grafts during insertion were traumatically inserted and the grafts were mishandled. This is a 1-session correction. Besides the very badly designed hairline and no temple match, and it's too straight, the grafts are too large. Also, do you see there's like this little dimple? These little dimples are what's called pitting. At the end of the procedure, the grafts have to sit about 2 millimeters at the skin surface above the surrounding skin. If it's flush or below, you get this pitting. That's why your team is so important. You can be a great surgeon, but if you have a bad team, you have a bad result. Also, you see how these look clumped? When the grafts are placed when they don't fit, when the grafts don't fit the sites, they create these problems of graft to site misfit, and it looks like a plug. This is a 1-session correction. This shows you the problem with a hairline that's too straight, but look at the angles. They're way too high. You drop the angles down, you pick finer hairs, and you convert a very unnatural result into one that you can't tell even close range. That's it. The course I'm running in St. Louis, I know it's a plug for it. It's really something I'm very proud of. It's 6-7 hours a day of hands-on lab where I'm literally watching you make these sites and critiquing you. I watch you do the hairline, I critique you. We've got 3D live demos where I'm actually drawing the hairline. You have 3D glasses on and you're watching me do this. You get so many lectures. And On Sunday, it's a whole day of just going through very complications, difficult cases, so that you understand how to stay safe. I'm very proud of the course. It's very intense. If you want to come, please come. It's in 3 weeks. In addition, it's only going to take 1 day off from your work. But if you have someone that you want to train as an assistant, it's not too expensive. Our assistants, we already have 49 physicians and 40 assistants. We max out about 60. So I can tell you, bring your assistant even if they've never been trained. If they're seasoned and they're great, bring them. And the way I've run this lab this year is that if you have a lot of experience, I'll let you just work on crowns with me. You can just do FUE. You can just do female hairlines. If you have no experience, I can pound you to death with that hairline until you get it and stay with the recipient sites. It's really tailored. So anyways, I appreciate your attention today, and hopefully you got something small out of that.